What people frequently don't do is they don't distinguish between GER, which is gastroesophageal reflux, as opposed to GERD, which is D, which stands for the disease. So this misnomer frequently leads to a lot of evaluation and a lot of references of patients that we come to see us. Now, GER frequently happens because the human body is designed to have few of those events during the day and night, but there are strict criteria of how often and how many of those episodes will happen throughout the day and night. GERD, the D component, the disease part, is very rare in kids. But it occurs. There's very few things you can do about it because any kind of medication or behavioral or even dietary changes usually don't address the problem, especially in the little babies. What happens is that with time, the GER events will eventually get better and normalize. And frequently what it needs to happen, just as having a conversation with parents and explain the natural course of physiological GER. In very few selected cases, when patients actually do get disease component of it, we can treat it with a variety of ways. We can use acid suppression medication if we believe that this is mainly caused by the acid exposure. We can do surgical intervention. We can also do promotility agents, which are the agents to help empty your stomach, for example. So those ways are available to us, but they're reserved for a very selected group of patients. The two red flags for me that I always tell everybody that the child needs to be truly evaluated by the pediatric gastroenterologist is poor weight gain or weight loss, and also increased risk of respiratory infections. And that's specifically becomes a problem and driving force in children who, for example, have neurological deficits because they are predisposed to having actually a disease of the gastroesophageal reflux. Most of the time, with just education, that's all it's required. It does improve with time, and we know that, and it has been shown in literature. But whenever you're concerned that your child is having too many respiratory infections or it's not gaining weight or losing weight, then this child definitely needs to be seen by us.